Hi there, my name is Jennifer Bashford, and the article that I'm talking about today is entitled One Third of Cancer Survivors Experience PTSD. I found it in the Huffington Post, and it is about a research study that was published in the Journal of Clinical Oncology. It was a research study that was done at Duke University that described how a third of survivors of non-Hodgkin's lymphoma still experience PTSD symptoms even after they have long since been cured of the actual disease. And in fact, in a lot of people, the PTSD seems to get worse, even as they themselves are physically much healthier. The survey was done by, it was about 600 people. They mailed surveys out to them. It was a longitudinal survey, so they mailed surveys out at the beginning of their treatment and then again about 5 years later. And they had about an 85% return rate, so that was a pretty good response. And what they found is there were a couple of determining factors, predictive factors, in who would actually suffer from PTSD. And just to clarify, PTSD is described generally, or for the purposes of this study, as a psychological condition where people experience severe psychological distress, anxiety, fear, sleeplessness, hopelessness, based on experiencing a traumatic event. They experience these feelings later in response to something that may remind them of that original traumatic experience. So these people were experiencing these symptoms of PTSD to something that may remind them of their cancer. These patients were describing things like driving past the hospital or seeing an image of a needle on the television that would trigger these incredibly intense psychological feelings, even though they themselves are completely physically healthy at this point. So this is something that's pretty interesting in terms of mind-body, how the body can be physically healthy, but the treatment that the body went through is still affecting someone psychologically 5, 10 years later down the road. So what the study did was it looked at some of the ways that we could possibly identify who was most likely to experience PTSD down the road, and if there were any ways to, if we could identify those people, if we could help them from, or prevent them from getting to that stage. So some of the identifying factors they found were people who were more likely to get PTSD were less educated, or less formal education, lower socioeconomic status. They had less of a close relationship with their doctors. They had less social support while they were undergoing treatment. And they were younger, they were at a younger age, so the younger you were when you were diagnosed, you were more likely to experience PTSD. And if you went through chemo, you were more likely to experience PTSD just from more of a physical trauma. And what they posited was that if we could identify those factors and stage an intervention beforehand, whether it was through bringing in a social worker to help with identifying people who had less social support and coming up with ways to provide them with the support they needed while they were undergoing treatment. Whether if someone was having a real issue with the chemotherapy and body issues, doing physical therapy, whether it was massage or other forms like that, to prevent them from going through these issues. Working with doctors to to work on their relationship with their patients. So there's a lot of different ways that we can work on increasing social services to prevent people down the road from experiencing these psychological impacts of the disease, even after we've cured them physically. As for the younger age, a lot of children's hospitals are actually starting to introduce really unique ways of staging the chemotherapy infusion centers for children with chemotherapy, children with cancer that are receiving chemotherapy. They're setting up the infusion centers kind of like video arcades with these 3D screens, and they're making it more of a social environment. They're playing movies, and they're making it. They're bringing in guest speakers and doing live screening events from like the local aquarium, so that kids are looking forward to the chemotherapy in order to reduce the psychological trauma on them, hopefully later. So these are all things that will hopefully benefit people in the long run as more and more Americans undergo cancer treatment and survive, which is a great thing that we're looking at for the body. And this is now a really good thing that we're now looking at the impact of that treatment on the mind years and years down the road. So that is my topic. Thanks.